Bakersfield, Sylvan Lake, followed by Calgary Curry.
Mary is 85 years old. She has dementia. She needs help eating and going to the bathroom. She needs 9 medications a day, and she's frail, and she is in a wheelchair. She lives in continuing care. Now, because of the government's new funding model for seniors' care, Mary is going to suffer. AHS has determined that patients like Mary can't meet the so-called outcomes and are therefore not entitled to the same level of care they used to have. Facilities that care for Mary are already laying off staff. To the Associate Minister of Seniors, it appears this new funding model is leaving vulnerable Alzheimer's dementia patients behind. Why?
Mr. Speaker, Albertans need to know and have confidence in our publicly healthcare system, funded system, that it's going to be there to respond to the needs of your constituent or Mary that you raised. Listen, at any time, the province takes care of the vulnerable people. We know that there are people like Mary's around. We have caring, loving, dedicated staff that make sure that she doesn't fall through the cracks. Sir, this lady will be taken care of.
Honourable member.
Thank you, Mr. Speaker. Given that the new AHS funding model is supposed to provide greater levels of care for patients with high needs, can you please explain how patients like Mary who have dementia and need help getting dressed, washing up and using the bathroom are having their care hours decreased?
Mr. Speaker, we talked about this a bit earlier, and the patient-funded model will respond to the needs. As the needs change, the responses will change. And Mr. Speaker, you can be assured that there will be patients that have less hours of service, and there will be patients that will have more hours of service. It will depend on the care plan and depend on the assessment given by the caregivers at each individual site.
Honourable member.
Unfortunately, those caregivers won't be there at each individual site. And given that Alzheimer's and dementia patients have apparently been left behind by this Alberta Health Services funding model, will the Associate Minister of Seniors please commit to reviewing the model so that the very unique and very intensive needs of these patients and their families families are addressed and not ignored?
Hear, hear.
Mr. Speaker, as we age and as the demographics change in this province, we're going to have an increase in higher levels of care throughout the province. This is part of the reason why the Premier and our government is committed to building more spaces across this province. Every one of the new spaces that we're talking about announcing in June or July will have care for dementia patients. Every one of those places will have opportunities for couples to age in place. Is it enough? Is it fast enough? No, it's not. We're getting there.